We're so excited to welcome you all back. This is the third session in this series. For those who I haven't met yet, I'm Carrie DeSalle. I'm a co-project manager for the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health, also known as Entec. We're so excited to welcome you all to today's event titled Diversity, Equity, and Inclusion within the Crisis Continuum of Care. This presentation is being offered through Entec, which is funded by the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, and all of the content that's being shared today is that of our presenters and do not necessarily reflect the views of SAMHSA or the US government. A quick reminder that a copy of today's presentation materials, along with a handout, have been sent to all registrants through the email. When it comes time, we'll also drop the handout in the chat box, so just watch for that. And then a recording of today's event will be made available after the session. Next slide. Just in case of any security issues that may occur, the session will immediately shut down and will not resume using the same join link. A separate email will be sent out to all participants with further instructions. So I'm going to just take a quick minute to go over our Entec Center, and then we'll get started. Next slide. Entec is a multidisciplinary team, a large collaboration by all of the partner organizations that you see here on your screen. And next slide. The goal of our center is that all children, youth, and families with emotional or behavioral health needs can access treatment and services in a well-coordinated system of care. Next slide. This is just a brief snapshot of those who we serve, from state and local agency leaders to mental health workforce, schools, youth, families, peer specialists, and more. We offer a variety of no-cost services. So we've got resources, coaching, training, opportunities, such as today's event, available to the mental health field at no cost. And you can check out our website to learn more about our center and to request any no-cost services. So in a moment, I will drop in the website into the chat box. But with that, I'm just going to go ahead and turn it back over now to our friends at Stanford Sierra Youth and Families to get us started.
Thank you so much, Carrie, and welcome everyone. If you are joining from the previous series sessions, welcome back. And if this is your first time joining with us, welcome today. We're excited to be here with you. My name is Ebony Mcclinton. I'm the Chief Family and Youth Partnership Officer at Stanford Sierra Youth and Families. And with that, provide support and oversight to a number of community-based programs operating in Northern California, specifically with a focus on peer supports, mentoring, but also working with youth that have been sexually exploited, that have been impacted by child welfare, juvenile justice, and mental health systems. And so our team provides system navigation, one-on-one support, team support, resources, and so much more, hope, recovery, wellness, and continue to do that through their work as well as advocacy. And I'll pass it to my colleague, Tamisha.
Good morning, everyone. My name is Tamisha Wallace. As Ebony mentioned, I'm the Youth Advocate Manager at Stanford Sierra Youth and Families, supporting our youth advocates in everything that she just mentioned, supporting our youth through systems, utilizing our lived experience, and supporting as cultural brokers along the way. So excited for the conversation today.
Yes. And our conversation today is focused on equity, diversity, equity, and inclusion in the crisis continuum of care. So we'll start off today really ensuring that we've kind of got, we're normed on common language and definitions around diversity, equity, and inclusion. We'll take some time to talk about historical and community trauma and how that impacts current systems in regards to crisis response, trust, engagement, and the needs there that we must be able to address and be cognizant of moving forward to be able to truly have more engagement in crisis response systems. We'll talk about strategies for change. and then some small steps that everyone can take to move the needle. We also have a resource for you, a assessment that can be taken back to your organizations and utilized internally to start unpacking first internal diversity, equity, and inclusion needs as, excuse me, as we believe that when you're first thinking about DEI, we have to start internal before moving external. It has to be practiced and modeled within the organization for it to then flow out into our communities. And so we'll provide that, and then there'll be some opportunity for dialogue as well in small groups, unpacking the assessment and some questions to really reflect on what we can do and some strategies we can take. So we're excited for this next hour and a half with you all. As always, please feel free to drop any questions you have in the chat. We look forward to this being not just an opportunity for learning, but a community dialogue. We all know that through this dialogue, through sharing our own experiences and asking questions is how we take these things back and learn more and deepen our understanding. So don't hesitate to drop in the chat if you have any questions. And thank you for those who are already placing who you are and where you're coming in from virtually, and continue to do that, and as well as include your role. It's always helpful for us to know when you're dropping those in, so that we can also ensure we're being mindful of all the different roles in the room, and make sure we address it that way as well. So what we have here are just, again, those definitions, and making sure that we have an opportunity to define what diversity is. And so simply define, diversity is how we all have very much so differences, both physical, cognitive, social differences, psychological differences, age, gender, sexual orientation, learning styles. And so diversity means that we're acknowledging the different ways in which others show up in their communities, show up within their families, show up within their employment or workforce or community as a volunteer. And diversity supports, or should be supportive of, an inclusive environment where everyone is valued. And so clearly the image to the right reflects when diversity is going wrong, but also a part of historical trauma and pain. And so we want to be able to acknowledge those historical information again, and we'll talk about that historical trauma and why it's important for us to look back so that we know a clear path of looking forward. But diversity also includes moving beyond tolerance and embracing rich dimensions of our differences. And so then when we're thinking about, so diversity are the differences, and recognizing that we all are unique in our own right. And then when we move into the term of equity, we're not just acknowledging that there's differences, but we also recognize that others besides ourselves have different access needs. So different points of where my differences impact how I respond to systems, specifically if we're talking about the crisis of continuum of care. So as an example of that, as a Black woman, my contact with crisis services is very limited based on my historical trauma, based on my experiences in the community that have diminished my trust with systems. And so when we're thinking about those individual experiences, so going back to diversity and how that contributes to equity, we understand that there's a lot of system inequalities. My experience as a Black woman is not singular. And so that often impacts how one utilizes services, underutilizes services, and equity means that we are going to do additional outreach to communities that have been harmed, additional outreach where disparities exist, so that there is an even distribution. And when I say even distribution, that means that we're adding to, which you'll see in the image here, to those maybe to make sure that that equity exists. And you've probably seen this image before. We've seen it in lots of different ways, those differences between equality, equity, and justice. And so equality means we're all getting those same resources. Everyone to the left of this image is all standing on the same rock. However, just because there's different heights here, we see that only two are able to look over the fence line. The equity, and this shows where there's going to be a difference in the resources that are distributed based on need and based on community need, that now the person that is shorter is receiving additional resources or additional rocks and has the opportunity to now see over the fence as well. And then justice is that we're removing the fence, removing the rocks, that those barriers are eliminated. And I think if we're thinking about addressing crisis continuum of care and any of our systems that continue to perpetuate inequities, that we really want to see the rocks and the fences just completely be removed. And we do this while operating out of a racial equity lens. And so when we're thinking about that, and oftentimes as we start to conceptualize what does operating out of a race equity lens look like? And I'd be remiss to not acknowledge that as we're talking about diversity, equity, inclusion, it's certainly been something that I would consider, and hate to say, kind of in vogue over the last couple of years. It's more at the forefront, but something particularly personal and meaningful to me that I don't want to leave. When we're thinking about a racial equity lens, we're wanting this to be embedded in all of our systems, not just as a checkbox, not just as something that's in our faces right now because there's been a lot of public dissension, but really just supporting others through a racial equity lens in all of the work we do. So we want it embedded in our practices. So as we're analyzing challenges, disparities, as we're looking at strengths, we're doing that from a racial equity lens. We're taking a look at data and information as it's coming to us and exploring race, ethnicity, and other backgrounds and intersections of race and ethnicity. We understand the root causes of why those disparities exist in our system. So we're taking a look at those disparities and how they exist and the root causes of that from a structural standpoint. When we're talking through a race equity lens, we're explicitly naming race. We're not, we're getting a bit uncomfortable if we need to be able to have explicit conversations to ensure that we're directly addressing the problems so that we can get towards solutions. And this helps us, right? It helps us to shape the structures that currently exist because we're naming it explicitly. But then again, we're looking at those points of intersectionality because it's not just that racial equity lens includes taking a look at the intersections of gender, sexual orientation, class, and other areas that impact those dynamics.
Ebony, can I add to that?
Please.
I think as we're looking at this for services, it's imperative that we look at it in our staff and agencies as well, as it is a domino effect. When we assess these issues, as Ebony mentioned at the start, within our agencies, it's a trickle-down effect of how we're then assessing and making sure that we're prepared to properly serve our various communities, depending on their intersectionality in the community. So I think this is just imperative at every step of the process.
Yeah. Absolutely. Thank you. So we're hoping you can use the chat to answer some questions. The other option is to also feel free to unmute yourself. But we're hoping to have just a quick, brief dialogue around these three questions. Hopefully this will give you an opportunity to reflect, So what institutional policy change has your agency been discussing or would like to see to integrate diversity, equity, and inclusion? So is there anything happening within your organizations now that is related to this? And then where have you seen or would like to see things change at your agency to integrate more diversity, equity, and inclusion? And then what activities can you personally participate in at your agency? So feel free to answer one or all of those questions, but we're gonna just kind of open the floor for any brave or courageous person. Again, being able to advance diversity, equity, and inclusion means kind of getting a little bit uncomfortable. So we'll be able to share some examples from our own organization in just a minute. Or Tamisha may want to share an activity or two we've been implementing now, or you can use the chat to share as well.
I know we'll touch on it later in the presentation, but something that I think has been amazing for our agency is our affinity groups. At I would say the height of the pandemic and dealing with a lot of the social injustices in the community after George Floyd's murder, our agency wanted to respond and wanted to create safe spaces for our agency team members to process and to have conversation. And unfortunately, the space did not feel safe because there were so many different folks and there were different experiences, and wanted to make sure that they could truly feel safe in expressing themselves and how they were reacting or responding to what was happening. And I think with our agency starting affinity groups for the Black, the Latinx, the LGBTQ community, even our white colleagues unpacking white privilege and having a safe space to really have conversations about what they're needing to know in order to respond as allies in the community. I think that's been great with just, as Ebony mentioned, being uncomfortable, but in a space with shared experiences and an understanding where you can truly unpack different things that are happening. So I would say that that's one of the most impactful things that we've done recently.
Yeah, that definitely has had an impact on myself, even joining the Black affinity groups and just feeling that connection. I'm seeing a few things in the chat, and then Chelsea has her hand out. So welcome, Chelsea. Thank you for sharing with us. I'm just going to highlight quickly a few things in the chat. Tabby shared providing Spanish only speaking events. That is an absolute fantastic way. Catherine shared looking at our defined values and how we are acting upon them in DEI ways. Yes, how is it expressed? So you've got your values, but how are you expressing them from a diversity, equity, inclusion lens? So thank you for sharing those. We'll have Chelsea share and then Michelle.
Thanks, Ms. Chambers. Thanks for having me. And a couple of things we're doing. I'm in Texas with the Texas Alliance of Child and Family Services. And one of the things we've done over the course of the last year is we have a couple of our team members participating with a Change in Mind and doing work with BBI, which is really about what you alluded to just a few moments ago, Ms. Chambers, in embedding it into our organization where we're not making a distinct, oh, we're talking about equity, but it's across all of our programs and across our projects and the brain science behind equity and what that means. So incorporating that into our work. And we have a staff retreat coming up. So we're having all the staff get together to see how we are incorporating that, how we'll continue to talk about it in our work. And the other thing is our organization is comprised of child welfare providers across the state of Texas. And so one of the things we have are work groups, and we have developed an equity and access work group that opens it up to members to come in and talk about ways we can create change, dialogue. And we've even got a research project happening right now around experience of BIPOC leaders in child welfare to gather data so that we can utilize that data to create some more change in our organization. So,
yeah, those are fantastic strategies, Chelsea. And I work actually with BBI, so I'm one of the consultants for them. And there is actually a BBI Leaders of Color. I'm not sure if you're familiar with it, but that's a resource that if you go to the Building Bridges Initiative website, you should be able to find those resources for those that are looking for it and are a leader of color, because there is some oftentimes can be isolation there and leading things or feeling like the weight of carrying diversity, equity, and inclusion is on the shoulders of leaders of color. So, but thank you for sharing all of those strategies. They're absolutely fantastic to hear. So kudos to your organization for taking the lead in that. Michelle.
Yes, good afternoon, everyone. My name is Michelle Abraham Montgomery, and I am the family fellow participating in the Lynn Fellowship at Children's Hospital of Philadelphia in Pennsylvania. And what we are doing now is starting an advisory group within the hospital regarding like microaggression and just helping. We're having like other family members and different families come in and meeting with the hospital team, doctors and techs and different things to help them to understand that a lot of times that we feel like they talk at us and not to us. And even just helping them to understand that when we're in the waiting room and we're there for a long time, we feel dismissed or ignored. And just having those challenging conversations to help them to understand that we know that you're doing your job and that you have a lot of other families that you're meeting with, but also, maybe if that's the case, to get another role in maybe a family relations coordinator or someone that can come in and talk to us while we're waiting to say, this is what's going on. We know you're waiting and their doctors are trying to get to you, but in the meantime, maybe asking us questions. How do you feel that you've been treated, or do you feel like you're being heard? That way that the family's voice and choice is definitely being heard and honored as well as respected. We want to definitely keep in mind that, there's nothing about us without us. So we want to always be included and felt that we are essential in the part of our healing, our children's healing, in the process of making us better holistically.
100% agreed, Michelle, and you're spot on in ensuring that when folks are in communities are coming in to seek support, that they're received with care and unconditional regard. And that includes, being able to engage right away. It includes, as a part of community, engagement, asking, how is this for you? How can I improve? We are not just, service providers. We are also in partnership and should be in close co-partnership with those that we're supporting. And that means that feedback loop, we're sharing strategies and they're also giving us feedback on ways that we can improve our practices. And that includes us asking, is this working for you? So I'm so grateful that you're making sure that those efforts are being put out in your community. So thank you for sharing. There's a few things in the chat just highlighting, and then I'll open the floor for Ty, who has their hand raised. But Janice, I think I said that right, shared in Orange County that they started an equity and OC initiative through United Way. That's interesting that United Way is supporting that. So that sounds great. And Lily shared our organization created a diversity committee with employees, and we provide feedback and policies, recommendations for trainings, educational information about different cultures and ways to be culturally informed. Yes, and we have a cultural competency committee at our organization as well, and it's staff driven. So, diverse group of staff from different departments and programs meet monthly to talk about that, make recommendations back to executive leadership for changes, trainings, insight activities. And we'll talk about that in just a bit as well, of how to incorporate that in your organization. But Lily, that's great to hear. Tabby shared, I'd like to see more intentional searching for resources and community partners that are created for and by marginalized people. So small churches that offer community aids and various African language translation services. Yes, absolutely. Leaning on community, having cultural brokers, promotoras, all are great ways to engage community instead of sometimes very large organizations that can sometimes be out of touch and missing those opportunities, really connecting back into community. Lots of good stuff in the chat. Thank you for sharing. I'm gonna pass it over to Ty before I come back to the chat. Hey, Ty.
Hello, great day to everyone. Thank you so much for what you've shared thus far. My name is Ty. I'm here in beautiful Colorado. My pronouns are she and her. I am represented on the beautiful land of Arapaho and our Ute, and we are so grateful for them for providing us this opportunity. In my organization, we are a new grantee for Early Head Start Childcare Partnerships and have had the amazing privilege of working with Dr. Freeman Foster and GIA to help support our diversity, equity, and inclusion lens to become more of a kaleidoscope, because we have had very narrow views in regards to diversity and just difference in general. And one of the things that we have learned along the way is that we must make sure that we have all representation at the table. And that is linguistic, that is various cultures, that's also various groups, affinity groups. And so some of the things that we're working on is creating these action-oriented principles related to our mission and vision of our organization. And it's been a great journey and discovery. One of the things that we've committed into action is every group meeting that we open up with our DEI statement now. And that's been very profound for our staff because a lot of them have not had that exposure or experience because they represent their communities, right? And we work within a lot of different communities in Colorado, and this is new conversation for them. And so we invite that new conversation with, you will be uncomfortable. When you have discomfort, you can share it or you can reflect with your supervisor later, but know you will never be disrespected and you will always leave with dignity. And so we've been identifying that as a part of our preamble in our collective groups. And I really feel like we're making great strides. We are definitely on a journey. It is absolutely a marathon and not a sprint, and we welcome it. And I'm very happy that my organization did not ask me to lead the charge. I am the only person of color, and I am being very biased and having some of my own implicit biases come out because I am the only Black person in my entire organization. And so it was very special not to be asked to lead this charge, and it meant a lot to me. And so, yeah, I'm excited for our journey, and welcome to hear all our reflections and stories. Thank you for letting me share.
Yeah, no, thank you for sharing. It sounds like a great organization, and despite you kind of being the only person of color there that speaks from your own experience, not having to kind of, bear the weight of navigating that alone, and others taking the charge really shows that they're trying to create a space that is truly inclusive and equitable, because we know if we're the only ones leading it, that is not an equitable space. So great to hear that. You mentioned affinity groups, and Tamisha mentioned affinity groups, but I just know that oftentimes I'll start talking about them and don't define what those are. And so just really quickly, for those that are new to that term, affinity groups, also known as employee resource groups, is an opportunity for those that have similar backgrounds and experiences to come together in the workplace. So we hold affinity groups. We have, Thomas, you might be able to share, I think it's about 7 different affinity groups. We have a Hispanic Latino affinity group, African American, LGBTQ, and so on and so forth. And so we meet monthly, and it's just an opportunity for us to connect. It doesn't necessarily have to mean that we're talking about work. Sometimes we're talking about what's happening in our personal lives. We're having fun. We're naming Black superheroes that are, that we have enjoyed, or our own superheroes in our lives. Some of the intersections of how we feel embraced in the workspace come up as well. And so, it creates that connection. It allows us to connect with others and not feel, say, that we need to maybe even police ourselves, which can happen oftentimes in different spaces as a person of color, especially when you are maybe a small group. There's a small group of you. So it's just a great way to create some authentic relationships and connections with others, and research shows that it has a direct correlation to employee retention and morale. So if that's something that you have not are not familiar with, it may be something to check out for or within your organization. And then something else, Ty, you shared about, not having to be the person to lead those efforts. And if I can, before we leave today, I will drop an article. It's called Impossible Burdens. And so what you're speaking to is not having to navigate those impossible burdens. But for our white colleagues that are joining today, I think it's an important resource, not just for our white colleagues, for everyone, but to really look at ensuring that when you're addressing diversity, equity, and inclusion within your workforce, that the burden is oftentimes feels very impossible as a person of color, as someone who is experiencing day to day, not just navigating life, which we all know is difficult in itself, but then adding the complex layers of race, sexual orientation, and some of the other intersections of our identities is even particularly challenging. And then to ask within that workforce to be the only person addressing it oftentimes is this impossible burden that oftentimes we bear. And so the article really highlights those impacts and what you can do as an ally to support efforts. If I don't drop it, feel free to just jot it down and then go ahead and look it up. Just going back to the chat, there's also some more great strategies that are being shared. Catherine Spurlock shared, inviting staff to provide input to ensure we are welcoming BIPOC to our center, as well as speaking their needs and acting in an inclusive way. Camille's got a fully compensated DEI manager who works alongside the DEI committee, and absolutely great. They're starting affinity groups. They've got the BIPOC, LGBTQ, and white-bodied. We also, I didn't mention, we do have a white privilege group that meets as well. So great opportunities for sharing. I shared a couple that are related to race, ethnicity, or identity, but we also open the floor to our organization to ask what other groups would they like to see. It's just a matter of creating it. So there can be a single parent affinity group within the organization if they'd like to meet and connect. There's no limits to the different types of groups, as long as it falls within compliance of HR, and that is dependent state to state. So you'll know that. You'll want to make sure you're checking in with them. And then Tabby shared giving voice to space. And a wellness recovery festival sounds fantastic. Land acknowledgements absolutely are a great way to start meetings. Very similar land acknowledgements, ties shared, starting off meetings with their DEI statements and their values. So multiple touches. Again, we talked about this permeating every aspect of the organization and the work that you do. And that just means that there should be multiple touches, but also embedded into staff meetings, dialogue, consultation. We are working towards having, when someone's even applying, that they're checking that they've read the diversity, equity, inclusion statement upon applying, so that there's clear connection, and they're in agreement with it. So when we're saying that our organization works to dismantle white supremacy, that if they read that and they don't like it, that they may know already that that's not the organization for them, versus onboarding and then hearing us start to talk about some of these things that show up in the workplace and go, oh my gosh, I didn't know this was this kind of agency. Well, you do now, because you signed off before you even applied. And then of course they'll have those multiple touches. We have it on our website, and then we talk about DEI and our team meetings. We're talking about what's happening in our communities, what are our community needs? How can we better address them in a culturally responsive way? So multiple ways and multiple touches.
I think that's also accountability to the agency and leadership as well, Ebony. I think Chelsea spoke to the transparency of their sharing with their team. This is what we're doing. As we're collecting this information from you and we're asking, here's how we're being responsive to it. And I think when it's tied into agenda items and we're talking about current events, that's bringing team members to the forefront to say, hey, are we talking about this thing that just happened? So I think it holds a level of accountability to the agency as well.
Yes, absolutely. And so I talked about earlier about just how important it is to name some of the historical trauma and system trust or mistrust in our systems of care, and how it's impacted our communities. And so there's a lot here. I'm not going to go over all of these, but certainly our communities have experienced some of these traumatic events and stressors, abuse and loss. And when you think about the ones that are bolded, specifically connected to addressing crisis, there are some key indicators here that really impact engagement with our community. So institutional abuse, right? So how has experiences before coming into the crisis response system impacted their ability to engage? What was their past experiences? I think it was Michelle. What did Michelle share? What are they being asked for feedback? How are they engaged, right? And so if those things are not happening, it's not a healthy environment. It's not a healthy environment. And so that abuse impacts their ability to then say, contact crisis response, or how they're engaging with crisis responders when they're having a behavioral health crisis. Areas like hate crimes, separation from family. We had, when we were really seeing high instances of ICE in our communities in California, we had little yellow cards that we were providing to families so that they were aware of how they can respond if they were needed, if they had an emergency, but they were worried about calling emergency services for fear of separation from their families. And so how can we then acknowledge that there's a high spikes in ICE and family separation, while also creating safety for addressing their behavioral health needs? Because one shouldn't, right? Those shouldn't be separated. I should be able to safely address my behavioral health needs without fear of family separation. And so we know that exists, and that creates the fear, and then that creates the lack of calls. So being able to understand utilization rates within your communities, if you find that you have a community that is 23% Hispanic Latino, 15% African American, but the utilization rate for those communities are lower, we have to be able to look at where has the system trust and traumatic events happened within those communities, and how can we start to rebuild that trust so that they can engage. And then even better, that the comment in the chat around exploring small community partners that are culturally responsive, that know the community, that are embedded into the community, is another step in rebuilding that. So creating those strong partnerships with community-based organizations that have closer touches as well. And so continuing to talk about those factors that impact behavioral health engagement. So just flat out racism, discrimination, fear, cultural and social influences. How historically has outreach and engagement or utilization looked for communities? And what are the environmental factors? Things like access to, fresh foods, communities that are particularly impacted by violence. All of these things are factors that impact that behavioral health engagement. So that's where we really come in, because it's one thing to know that it exists, which it's important for us to really name it and know that it's there, but we also have to then understand it, and not just from here are the community trauma and community impacts and community, right? But what are the strengths? What is the joy? What are the areas in the community that are thriving, and how are they doing it despite, some of the barriers that are against them? Those are the areas that we want to elevate. When we're operating out of that strength-based lens, we're looking at community, the community health, the economic health, spiritual institutions, their access to safe and affordable housing, learning institutions. Here in California now, we've got, free community college for the first 2 years in California. Those are just some of those ways that we can see where there might be opportunities for our communities to continue to learn and connect them to the rich resources that might be available. When the pandemic hit, we had Wi-Fi buses situated in different communities because we knew that Wi-Fi was a barrier. So how do we start to think about all of these different strengths and beautiful tapestry of resources, community members that contribute, sometimes without pay, without recognition, to their communities, those community leaders that are often unrecognized, and build that into our assessments and community strengths and needs. So we're not just looking at how harm has happened, but we're also really taking a critical look at how they're healing and how their resiliency and protective factors impact how we're going to engage and what we can elevate when we're engaging with them. Also understanding specific health and wellness needs of the community as well, and their view of crisis response and emergency response systems. So lots of opportunity to have focus groups, to have panels and listening sessions, to have a better understanding of how do you view it? Would you access it? What would it take for you to access it? And how can we support and be a bridge and build trust back within the community? And sometimes that's not just talking about it and holding these sessions. In Sacramento County, we had sessions held for the African-American community. We were looking at strengthening our services. And when I say that, I'm not saying I mean Sacramento County, not Stanford Sierra Youth and Families. And they did a lot of listening. I came and showed up with my 17-year-old son at the time, a few years back, because he was navigating and accessing resources, and we were giving our voice. And a couple of years later, right, it takes a while to move it upstream, they released a RFP for funding for serving the African-American community. And they had completely missed the mark based on the listening sessions. So it's not just listening to our view of crisis response, it's actually embedding it. It's following up with community members that are sharing their thoughts, and it's also compensating them for their thoughts. So when they're showing up, they are operating in partnership and also should be stipend for their feedback when they're offering it. It's how we improve systems, and we need them, and so they should be compensated for it. But so looking at these different factors and asking these good questions is an important part of assessing those community needs and strengths. So here is, our call for action in regards to how do we really kind of take a look and take some actionable steps. First things first, for sure, that community needs assessment, but also an internal assessment within your organization of what are you currently offering? What are you currently supporting? When I mentioned family and youth partnership talks about these things in our staff meetings, do the other departments and programs do that? It shouldn't just live in one program or department. It should be consistent throughout the organization. So as you're thinking about training, supports, and other mechanisms that can embrace a culture of learning and diversity, equity, and inclusion, ensuring that those trainings have a focus on anti-racism and anti-hate education. I would take it one step further and say it should also include anti-Blackness training, because that permeates throughout every culture and community, and has a huge impact on the Black community as well. Prioritize hiring and retaining culturally diverse crisis responders. So for those that are here, and I saw in the chat, thank you for putting your roles, your role in crisis response. The community needs crisis responders that look that are a reflection of their community, that look like them, that have some similar or shared experiences. It does have a meaningful impact on outcomes and positive outcomes. So who is the diversity of your team? Think about who you're serving, and see if there's an opportunity to build a reflection of those demographics within your workforce. Acknowledge that the system has been and has housed and continues to house biases and prejudice since the inception. If you're looking at historical timelines of behavioral health and crisis response systems, it was created and embedded on white supremacy, on slavery, and so that continues to show up even in present day. And so we have to be able to acknowledge that it was housed and started in its inception and continues to be embedded in our systems. And that's why we have to look at it from every lens to start to work towards seeing that shift. If we're looking at system change, again, we shouldn't do that without those that are impacted. We have a saying, I know my folks have heard it, we say nothing about us without us. And that just means we're not creating systems without those that are directly impacting us. And so that means that we're going to operate in partnership and ensure that those impacted voices are a part of the design, the implementation, and the evaluation loop. And then that takes us to step 5, which is creating opportunities to receive feedback from those that are receiving services. And here's just some examples of some different opportunities. So, when we're thinking about learning opportunities and creating a culture of learning, I think that's another step internally when we're talking about diversity, equity, and inclusion, is that as they're onboarding, they're having these multiple touches around our values, but they're also we're also acknowledging that we're a learning organization. So if you're joining this organization, you are a part of a learning community that will continue to challenge status quo, continue to challenge systemic structures that perpetuate and harm communities. And so that identifying how bias and stereotyping and discrimination have limited the roles and contributions of individual groups is an important part of that learning opportunity. That's a part of someone's learning journey. And acknowledging that everyone comes in with varying levels of understanding, of privilege, of different walks of life that contribute to how they show up in an organization. And so we acknowledge that those different walks exist and embrace that. Sometimes when we're talking with folks, we're hearing the first draft of something that they're thinking in their head because of the fact that they're learning this information new and they're trying to understand. So we're assuming positive intention to create that strong learning community with others. We're encouraging all members of crisis response community to regularly examine assumptions, prejudice, and obviously not limited to racism, sexism, and homophobia. So we're looking at all of these areas, and then coordinating with trusted community organizations that have that rich culture connection to community. So there's lots of models out there related to crisis response. Crisis Now is one that's highlighted, alternatives to policing, all to address crisis response in our systems. And so promote those, promote services and trainings that are alternatives. We see, and history has shown, that if police are showing up in a behavioral health crisis situation, that it oftentimes ends in violence, and particularly high rates of that for communities of color. So we have to look at those alternatives to policing and find authentic ways that we can engage with community when they're experiencing a crisis, whether we're addressing or going out to their community environment or they're coming into our buildings and our organizations, that it's a safe space to be able to do that. That there is consumer education that informs and provides access and partnership in any treatment decision that impacts them. that you're collecting data on we talked about utilization already, but who are you serving demographically? Working with, if you have a QI team or someone that has the ability to analyze the data. If you don't have someone within your organization that is looking at the demographics, where we truly are not sure if we're operating out of an inclusive and equitable lens. And so it's important for us to know who we're serving and those impacts and the outcomes for those communities. So so really, ensuring that you're doing that research. It's an important part of the process.
I think Ebony just got into that last slide. I feel like the basis of all of those all of those connections is relationship. So we can offer trainings and education. We can partner with consumers to receive information. But I think if that solid relationship doesn't exist, the trust isn't really fostered. And I think as we're looking to really change systematically, I think we really have to think about how do we shift the foundational relationship so that we can really have the honest conversations at the table. I think if we train, let's say, police in our community, we can have that training and walk away. But if that relationship is there, we know that we can call them and say, hey, this happened, and and give them the experience of the youth. I think we can follow up on that and build on really the accountability that we keep talking about. If it's embedded in every step of the process, that relationship has to be there to keep the conversation going. So I think as we're looking at these opportunities, we also have to think about how do we really develop that relationship to keep it going.
Absolutely. Yeah, those relationships matter, that consistency with community, addressing harm if it's been caused in the past. I was at a presentation with our LGBTQ center here locally in Sacramento. And we're all a part of a behavioral health race equity collaborative. And they started their presentation off in a very powerful way. They shared past community harms that they had caused to communities of color and named explicitly some of the instances that even I was aware of that as I've been in collaboration with them at times for supports and services. And there was just something about, that authentic transparency that, just really, I think, pulled the walls down where there were walls up by saying, we haven't done the best job here. But here is our goal of moving forward. And here's the steps we've been taking. And that's that authentic engagement that I think Tamisha is sharing and how important it is to build those relationships. So here are some areas that also, can happen within the organization. We talked a bit about the Affinity Group, and this was something we just launched here, creating that safe space. But some of the other areas around building the agency culture of equity, we have cultural brokers. They are, staff that are providing supports and services, managers, directors that are operating oftentimes out of a cultural broker lens without even realizing it. They're sharing resources, they're stepping in and building a bridge between, say, management and staff, or, stepping in and providing additional trainings, feedback, consultation, and learning opportunities. Or they're, being oftentimes referred to, say, all of the African-American boys that are in the organization because they have a strong connection there. Those are the cultural brokers that we identify within the organization, and they receive an additional stipend quarterly for the additional supports that they offer to the organization. Again, the work that they're doing is naturally happening. So this isn't something that's added to their workload. It's something that they're naturally already doing. And we wanted to ensure that they were recognized for that and compensated for it appropriately. So that goes back to that conversation around impossible burdens, and not, this is them saying, these are the things we want to do. And of course, as they're actively and naturally implementing it, we are recognizing it through an opportunity to compensate. So if there's opportunity to do that within your organization, highly encourage it. The cultural insight activities are another opportunity for learning. And Tamisha, you might be able to step in and share some of the most recent ones. We're examining privilege. Yeah, we're just examining lots of different topics.
Yes, and so every new hire at our agency attends a cultural competency training, and it's quarterly. So that's the one-stop shop for cultural competency. And we realized that we needed to continue these conversations. So what we're doing is pulling concepts from that training and having quarterly follow-ups with cultural insight activities. The most recent one being unpacking white privilege and white fragility. As we're talking about DEI more often in the workspace, I think it could feel more uncomfortable for folks if we don't have the common language as we're throwing out words like white supremacy and white fragility. And our colleagues are like, what do you mean by that? Or I feel attacked. And it's a really level setting conversation of let's really define what this is. And let's talk about how this shows up in our systems and within our agency and for our youth and families. And it's really a moment for program directors to really have an honest conversation with their team as we're talking about trust and making sure it's embedded along every step of the way. Each program team is responsible for really implementing this activity and having a follow-up conversation with their team and making sure that the information is actually sticking and it's not just a one-stop shop training. So we're asking again the cultural competency committee, again, leaning on them as consultants of what are we seeing and what do we feel is necessary to really roll out next. So I think this has been very great with continuing the conversations.
Yeah, it really drives home that, the topic around being culturally responsive is not a one and done. So you can't just receive a training when you're on board and congratulations, you're now culturally responsive and go out and go forth, right? It's happening in one-on-one consultations. There's cultural insight activities. And we've even evolved. Cultural insight activities started, probably 5 or 6 years ago. And at that time, the Cultural Competency Committee kind of was like, okay, I'll go to this team meeting and I'll do the activity, I'll facilitate it, and I'll go to this team meeting. And we were all kind of dividing and conquering. And we recognized that in doing that, staff were really uncomfortable. They didn't know us because we were joining a team we weren't familiar with. We were leading the activity. There was no onus or accountability and ownership from the director of the program who was sitting in those meetings. And so now the Cultural Competency Committee trains executive leadership to implement the activity, and then they're responsible for leading those discussions within their teams. They're building the trust. They're sharing, I don't know, I'm learning too, and creating spaces to where they can increase their connections, collaborations, be transparent, and be vulnerable around topics that historically, I always share 20 years ago when I was joining the workforce, there was no discussion of race. There was no discussion of sex. There was just some things that were completely taboo in the workspace. And now we're saying this has to happen. It's actually critical to the success of the organization, to morale, to retention, to being seen and heard. And so, but we don't know how to do it. And so it makes sense that there's going to be that discomfort that happens. And so multiple touches through cultural brokers providing insight, to the affinity groups, to the insight activities are all just ways to continue to work towards embedding that community of culture and equity within the organization. And so that's internal community, internal organizational strategies, and then thinking about how we partner with our community. So building community engagement. We hold quarterly panels and listening sessions where our families that have received services or are currently receiving services are on a panel. We're asking them questions around their experiences, what we can do to improve, what strengths they saw in the services that they've received, what they'd like to see more of, and it's a staff training. So again, they're compensated for their time and providing us with their feedback, and then we have moderators that support the dialogue, and then staff can ask them questions as well. But creating just spaces where we are saying it is a part of our practice ongoing to regularly receive feedback from those that we are in partnership with, and leans back into that nothing about us without us. Our advocacy team, family partners and youth advocates, also have initiatives where they look at community partners. So very similar to what was shared in the chat around, let's look at these smaller organizations and community partners and make sure that we're not operating in silos. And so our team reaches out and finds out who do you serve? Can you hook some of our families up with that for free? What can we do for you? Can we provide you with trainings? And then in place of that, can we have an MOU where our families know that this is a safe space for respite? So just lots of different community partnerships that will enhance the services that our youth and families will receive. We have a barber who's now saying, hey, every first Monday of the month, the youth and families that are served at Stanford just need to make an appointment, and they'll come in and receive very reduced priced haircuts, because I don't know if y'all know, but the cost of barbers now is like $40, $50 for a haircut. It's so ridiculous, right? Which can become a factor of, right, when we're thinking about a young person's well-being and how they're perceived and their hair not, being combed, having a barber and having that community partnership of a barber who's willing to provide those free and reduced haircuts to our youth and families is a great resource and connection that we're establishing in the community that will support youth and families. Oh, I'm seeing something in the chat here. That is why only my son gets his cut and not me, right? Seriously. I'm like, I want to cut my hair, but Tamisha keeps telling me how expensive the haircuts are. And so I'm like, oh, I guess I'm gonna keep doing these flat twists. All right, so we've got some other steps, again, to move the needle. We've talked about some of these already, but to highlight a few, if there's an opportunity for you to develop a DEI strategic plan, that really does kind of help you to formalize what you're going to do. For it to really truly be embedded in all the areas and for it to be living and breathing, you first got to plan for it. You got to put intention towards it. You got to write things down. You got to address the areas that are going well and some of the areas that need improvement. And so to be able to do that takes some strategic planning, community input, staff, internal input, seeking that plan of approval if you've got a board. So talking with your board, making sure the board is educated on your efforts, making sure they're also trained in cultural responsivity, and see if there's an opportunity to seek some stewardship. So some funds. I saw also in the chat that someone shared, we hired our DEI manager. And so we're starting to take these steps. So yes, putting some money towards these efforts, obviously not making that DEI manager or director the sole responsible person for leading the efforts, but for them to hold the measure of accountability for those efforts to be embedded into all of our systems, and have them lead, kind of measuring how that's happening and the quality of it. And then implementing that strategic plan and evaluating and communicating your impact and adjusting as we need to. All right, so we've got an opportunity to have some small group discussion. Before we do that, I want to share in the chat, or Carrie, I believe, is going to drop in the chat, a handout. I believe you might have received it in advance. I've had the pleasure to be able to work or meet Dr. Shoyanka, who developed this SMART assessment, and so if you can, hopefully everyone has the opportunity to click it, download it, and open it up and take a look at the questions. It's an opportunity for reflection of internal. If you're looking at how do I address this internally, there's some great questions on here that we can start with. And so I encourage you to open that. If you're not able to, or you can do both, take a look at the questions that are in this handout. And then also there's some questions here that are here available for us for breakout. And so one is, how does your agency's mission, vision, and values demonstrate a commitment to equity? And I think someone shared, like, yes, it's got to be in our values. We got to talk about it and breathe it here. How are our stakeholders most affected by the issue involved in addressing equity? And how are they affected if we don't address it? How do we be proactive at bringing diverse communities to the table? So that community engagement and participatory engagement is extremely valuable in this sense. And how do systems contribute to inequities and create barriers to equitable opportunities? So you may not have a chance to answer all of these questions, but there's a lot here to get started, as well as the SMART assessment tool that you might want to open up and reference and see where are there things that might be missing as you look at those responses. What are areas for growth? Is your organization examining these areas? Is your organization doing really well in those areas? We'll take about, it's 10:04, we'll take about 15, let's say 17 minutes or so. That gives everyone hopefully a chance to share. And then we will come back and have an opportunity to report out before we close our time together. Oh, and those questions are in the chat now. And so breakout rooms will open shortly. We'll see you back, and I look forward to hearing the discussions and hopefully some great strategies that you can think of moving forward. All right. Welcome back, everyone, and thank you for joining and staying on for this last part as we report out. Those questions are still in the chat, but I will drop them one more time so that if you have a question that you answered within the breakout room that you want to share, you can lean on these questions here or just share any other learnings or anything that stood out to you in the AACP SMART tool that was provided. So this is just an open floor before we kind of close out to see what came up for you, and is there anything that you're able to take back to your organization in regards to next steps to advance diversity, equity, and inclusion. You can use the chat or you can unmute yourself. We'd love to hear from you. Hey, Tamika.
Hello. So I was just going to say there were a couple of us talking in our group, and one of the things that I raised too, it came out of one of the questions, spoke to how this is such an intentional process. And so I think the question was about reaching different, I can't remember the exact question, but reaching the different populations. And one of the things that I shared was that we have to be intentional about identifying not only the people that are accessing our services and resources and utilizing a DEI lens for that group, but also acknowledging, finding ways to do, and this may be a community assessment of who is actually in the community and who are we serving and who are we not serving, and why are we not serving this particular population? What are the barriers, or why is this group not accessing the services that we have to offer? I think that speaks also to the equity part, but also just to some of the other things that you all have shared in the training today.
Absolutely. Yes, those intentional efforts of understanding who we're serving, but who's missing, right? Who's a part of the community that we're not serving, and how do we build our engagement and outreach to those communities to ensure that if they need those services, they're they have the access and trust to do so. That's a great strategy, Tamika. Others?
Yeah, very similar to Tamika in our group. We spoke about services rendered to populations that we know that are there, but there actually no services for them. And Ms. Geneva, if you're all right with me alluding to what you were saying about Philadelphia, is that there's a large API community there and there's no services, there's nothing being offered to that community, and just knowing kind of the historic background of all different kinds of folks coming to America and California to invest in kind of the American dream and being heavily traumatized of being put in concentration camps, torn away from their family, just things like that. And so we know that the trauma exists and that we know that there's been harm and there needs to be some repair and some reconciliation, but not even that is being offered. And how do we build those bridges? How do we be more inclusive and bring them into the fold? And how do we do that, especially as other folks who identify as BIPOC or people of color, and really show solidarity in those kind of ways? So we touched on that a little bit in our group also.
Absolutely. Thank you for sharing, Tanis. And I think it really speaks to, we can all show up as allies, when, we have all these different intersections of our identities. And so when we know there's another group that is disparaged or experiencing, community isolation, we have the opportunity to show up, to speak to some of the harms, to speak to, some of the inequitable outcomes based on, their needs, and try to work towards addressing it within the organization. So, yeah, thank you for sharing that. Others? And if there's no others that want to report out, the conversation is still open to do so. If there's any questions you have. Because we wrapped it up in a ball, threw it back. It's working. You guys got all the strategies and skills. You're ready to go. Oh, Geneva was like, nice try, ma'am. Please, Geneva, share. I see your hands raised.
I would like to know, how can we build strategies to bring those populations that are not at the table? How can we build capacity for them to improve and bring their voice and become stronger, and for them to become advocates for themselves when they're not even showing up in our populations of services? Right.
That's a great question, because you're really talking about, capacity, some capacity building, but also understanding the reasons behind it. So it may not be a capacity building issue. That's an assumption and a bias, right? Whether they can easily be perpetuated. I would say we have to ask the community. Again, though, that goes back to leaning to organizations, spiritual institutions, anyone that is connected deeply to the communities that are missing and not showing up, and reaching out and saying, we know you're here. And we want to build trust. We want to build engagement. Maybe you're fine. Maybe you're not accessing services because you have a strengthened community network that doesn't need to rely on some of the public systems that we're a part of. And that is great. We just want to make sure, right? We want to double check. And so by asking those questions, by going in, again, I keep saying stipend, community members say, hey, we want to compensate you for your time and your feedback and your input. It's helping us to better understand our communities, and helps us to shape how we move services forward. So taking the time to truly kind of find ways to connect, and then invite them in for dialogue. Even if it's, you only get 10 to 15 folks, it really oftentimes does provide a really great snapshot of what someone's experiencing, what the community is experiencing, what the pulse is, and the culture around engagement and services looks like.
I would also say, or go to them instead of inviting them into the conversation where they're naturally gathering in their safe spaces in their communities, ask to be invited in and start that connection point there, because I think that's where that trust truly is established.
100%. Yes, yes, and yes. Yes, meet them where they're at. Justice.
Hi. So our group spoke about language and framework of ideology. So the language that we use with the people in the community that we're trying to serve kind of changes the way the connotation of the conversations go, especially as far as using their lived experience as expertise, right? And understanding that they are the experts in their experiences and they are the experts of their lives. And that kind of empowers them in a different way to where they can find solutions or help them. We can help them find solutions that are more equitable and tailored to what they're comfortable with, right? What they can see themselves doing. And that's kind of where that equity piece comes from, because we can say something that we think may be equitable for them. However, if there is a difference in their culture, they may not see that as equitable and may actually see it as something that could be hurtful, right? So definitely realizing that they are the experts in their lives and using that framework and that mindset to kind of fuel how we go about helping and supporting. So that's just kind of how we rounded off our conversations on equity.
Absolutely. Thank you so much for sharing, Justice. It's that person-centered language and really making sure that, and it's in the chat as well, Tamika said, language, how it can either hurt or help when it comes to equality and equity. And so being mindful of our language, how we speak with communities. Are we operating in partnership? How can we assess our own values and biases? Do we truly see them as the experts of their lives? And if we don't, what do we need to do to unpack why we consider ourselves the experts over their lives, right? And so doing that that type of assessment on our own selves is equally important, because that impacts our language, right? It impacts us saying, you're a client and I'm here to give you your tools, versus we're operating in partnership for your well-being and recovery. It feels very different. So thank you for sharing that. I see a couple of hands are raised. I do want to acknowledge it is 10:30. I'm happy to stay on for another minute or so, but just want to acknowledge, Michelle said, never mind, I'm taking my hands off. Thank you all for being here today. There is, yes, stay forward. Thank you, Ty. There is the evaluation in the chat that's available as well for you. We thank you so much for attending today, and I'll pass it to Carrie to close us out if there's anything else she wants to add.
No, I mean, thank you very much. You pretty much summed it all up right there. Just wanted to give a big thank you to all of our participants today. Thank you for engaging with us in this important discussion. A huge thank you to Ebony and Tamisha from Stanford Sierra Youth and Families. Again, we dropped the link to the survey in the chat box. I'll post it just one more time in case anyone missed it. Please just send us your feedback. Let us know what you thought about the session. And if you have any topics or preferences for future trainings, please feel free to note that in there as well. Thank you all so much. I hope you all have a great rest of your day, and we'll see you next time.